What type of plastic surgery do you specialize in?
The most common procedure that patients typically come into, my practice in particular, because I do focus on that, which is breast enhancement, whether it's a breast augmentation or a breast lift with an augmentation or removal of implants for newer implants, and also adjustments of the pocket where the implants sit to give you more cleavage and upper pole fullness. Or that array of procedures is typically what I see the most common. But if I was to discuss what is the most common in the country, United States, it's really breast augmentation or some sort of breast surgery that's usually done concomitant with or in place of a breast aug. The other procedures is liposuction, which is body contouring. And then after that, there's the mommy makeover, which is a tummy tuck or abdominoplasty. And with that, many times, being that it's a mommy makeover, you combine a breast augmentation or a breast lift augmentation with a tummy tuck. In my practice and what we see, which is established in 2001 here in Austin, and I've developed a bit of a niche in terms of complicated breast surgery, which is really more focused on patients that had their breast aug and were unhappy from the beginning because they didn't get what they wanted, either too big or too small or too wide, too far apart, poor position of implants, or changes that occurred over the years, pregnancies, weight gain, etc. So they come into the practice for me to look at ways or give them suggestions and ways to enhance what they have at present in a way that gives them the goals that possibly were not met with the first surgery. And that's very common for me to see patients that were unhappy from the beginning, and that's unfortunate. I have a philosophy that part of that comes from a lack of paying attention to the specifics of what the patient wants before you go to surgery. And I think that's so mandatory. It requires time with the patient, it requires discussion with the patient, combined with my staff to go over details, and the patient to also articulate it for themselves or come up with a thought process for themselves of what is it they want to achieve, what is it they don't like, what specifics, because it's specifics that have to be addressed. Combining photographs of what they find online of patients who've had similar surgeries as them with results that perhaps are more consistent with what they would have liked to have achieved, or with results that are not what they want. Because if you show me what you don't want in a photograph, it's as useful, in many ways, a bit more than what you do want. That really makes it clear for us to understand when we go to surgery, I'm thinking at your level and in your thought process, which I think has to be that way. So every case that we do, we spend the time to really get in the patient's head, give the patient also time for them to get in their own mindset, what it is they want to achieve with specifics.